Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on hidden secret number 17 of why you can still have low thyroid symptoms even if your lab tests are normal and even if you're taking thyroid replacement hormone. In hidden secret number 17, it is due to an underconversion of T4 into T3 due to a deficiency of dopamine. Now, dopamine is a neurotransmitter, and it is generally produced in the central nervous system. It can also be produced in the periphery and outside of the CNS. And people that have low dopamine aren't able to produce sufficient amount of 5' deiodinase enzyme, where that's the enzyme in your liver that helps you to convert T4 into T3. And in previous videos, we talked about dopamine, and if you don't have enough of it in your brain, it doesn't allow you to produce thyroid stimulating hormone. And if you can't produce that, you can't produce any thyroid hormone. So people that have dopamine deficiency in the brain will have low TSH and low T4 and T3. If you have peripheral problems of dopamine, if you have a deficiency in the periphery of your body, what's going on here is that you may be able to produce sufficient amount of TSH and you'll have enough T4. So on the labs, your TSH will be normal and your T4 will be normal, but your T3 will be low because you can't convert that T4 into T3 in your liver. So people that have dopamine deficiency, they typically have ADHD-like symptoms. They can't concentrate, they can't focus, they have problems staying on task. A lot of them feel that they need to take caffeine and other stimulants to keep them focused and to allow them to just function doing activities of daily living. And what is the root cause of the peripheral dopamine deficiency? Well, there's two things. Number one is dysglycemia, or blood sugar dysregulation, blood sugar problems. Reactive hypoglycemia, insulin resistance, type 2 diabetes or being pre-diabetic, and overconsumption of sugar, which drives your insulin levels up and down, which can cause all kinds of problems in the other parts of your physiology. Number two is iron problems, either an iron deficiency or iron depletion, or you're having problems transporting iron due to an anemia. Either you have low amounts of red blood cells, or you may have hemolytic anemia or insufficient amount of hemoglobin. So a simple blood test will be able to determine that. Now here's one of the problems. Medical doctors routinely order a CBC. They routinely order a thyroid test, but for whatever reason they don't make that connection between low iron stores and the ability to make thyroid hormone, or they don't really make the connection between blood sugar problems and thyroid problems. You have to go to the right type of doctor that can take an overview of all these different mechanisms and see how they interrelate, and to be able to ask the right questions, order the right tests, and then interpret them, taking into consideration all these different things, because the body doesn't work independently, one structure versus the other. They all work together, and that's just simple physiology. So the way that we would be able to help with this problem would be to address it at its source. Try to figure out and correct the root cause of it, which is the peripheral dopamine deficiency, which would then allow your body to make sufficient amounts of 5' deiodinase enzyme, which will then allow your liver to convert that T4 to T3 and help you with those low thyroid symptoms. Well, I hope you enjoyed this video, and I hope you learned something. Please, if you have any questions, please feel free to communicate with me through my website at integratedmetabolic.com. Please subscribe to my YouTube channel, and please tell a friend. And thank you very much for checking out this video.